Good evening, everyone. The topics that I get for condition and illness in elderly is cardiovascular system (CVS). So today I would like to present about the function of CVS, effects of aging, and health promotion in older adults related to CVS, and also the selected condition and illness in CVS. So let's get started with the function of CVS. So the function of CVS is to transport the oxygen and nutrient-rich blood to other parts of our body, and also to transport the metabolic waste products to kidney and bowel. Then we go for the effects of aging. So for older adults, their valve will stiffen, which leads to functional murmur. Functional murmur means that it is not pathological, it is caused by physiological process, and it is harmless. So their left ventricular wall will thicken and stiffen, which cause reduce in elasticity and eventually lead to impaired diastolic filling. As an adaptation, the left atrium will increase in size to enhance the ventricular filling, but this will cause the increased risk for atrial fibrillation. Then the muscle volume for both ventricles will increase, which causes the ventricular hypertrophy, and the pacemaker cells will decrease in amount. So the maximum heart rate and cardiac output will decrease. Okay, for the vascular part, the aorta and the arteries will thicken and stiffen, which leads to reduce in elasticity and increase in resistance. Then this will lead to increase in blood pressure and left ventricular hypertrophy can occur. Then the vein valve, which function to prevent the backflow of the blood, they will reduce in efficiency and tone. Then the older adults, their lower extremities will develop edema easily and at higher risk for deep vein thrombosis (DVT). When all these changes combine, such as the vascular stiffness, increase in left ventricular and diastolic pressure, left atrial enlargement, and also increase in the atrial pressure, they will cause arrhythmia and also heart failure. But actually, in all the healthy older adults, these changes can actually have little or no effect to their daily life. But under the stress conditions such as environmental, physical, or psychological stress, they will cause increase in sudden demand for more oxygen. Then the heart may not be able to respond adequately, and they will take longer time to either accelerate or return to their resting state. So we as nurses, when we have to be aware that when caring for older adults, we cannot use the heart rate changes to determine whether they are in pain, anxious, febrile, or hemorrhage, because the heart rate changes may absent or this response can be delayed. So next we go for the health promotion in older adults. So for health promotion, we have 3 levels of prevention, which is primary, tertiary, and secondary. So for primary prevention, we give health education that focus on the behaviors to reduce the risk of cardiovascular disease (CVD). So the education that we can give include the regular exercise, because research shows that if we do not use the heart to its capacity on regular basis, it will actually cause heart atrophy. And besides, regular exercise can actually improve the muscle tone, which help in venous return. Then we can also educate them about the importance of nutrition, such as low fat, low cholesterol, and low salt intake, because this will increase the risk for atherosclerosis and also cause fluid retention. Then they will ultimately cause hypertension, which increase the heart workload. Then we advise them to maintain their ideal body weight and also tight control of blood glucose, because both the obesity and diabetes mellitus is often known to be associated with CVD. Then we advise the older adults to do smoking cessation, because nicotine can damage the blood vessel lining and also will increase the risk for atherosclerosis and increase in blood pressure. All of these will increase the heart workload. Then the older adult will get higher risk of CVD. Okay, then for secondary prevention, we promote the screening at earliest stage. So we advise the older adults to do blood tests or body checkup for every 1 or 2 years. So for tertiary prevention, we aim to improve the quality of life of the patient that already have CVD. So we will try to restore the heart function, reduce the disability, and also to delay or minimize the complication. So things that we can do includes educate them about the importance of complying to treatment and also follow-up so that their conditions can be controlled, and encourage them to join the cardiac rehabilitation program to improve their cardiovascular health. This may include the exercises that are suitable for the patients that already have CVD, and also how to live with CVD. And lastly, we can have health education. Actually, the health education is exactly the same in primary prevention, just that their aims are different. Health education in tertiary prevention aims to minimize the effect of the disease and to maximize their quality of life with CVD. Okay, that's all for health promotion. Okay, now we go to the last topic, which is the selected condition and illness. So the selected condition and illness, I will focus on congestive heart failure, CHF. Okay, so for congestive heart failure, I will focus on these few topics, but the focus area that Nzezu would like us to cover in our discussion, which is the ensuring safe of the procedure, I will not go to that point because all the procedures of CHF is actually based on the symptoms and underlying causes. There is no specific or special procedures for CHF. So I will go for specific assessment for congestive heart failure. Okay, first of all, we look into the definition. CHF is actually a condition in which the weakened or damaged heart muscles they are unable to pump enough blood to meet the body demand. So as a consequence, the blood circulation will shift to vital organs such as our brain and also heart. Then the kidney will receive less blood, then they will filter less fluid into urine. This causes the extra fluid in circulation builds up in lungs, livers, eyes, extremities, and other parts of our body. Okay, next we go to the causes. Okay, first, the myocardial infarction, coronary artery disease, and congenital heart disease. All of these diseases, they will cause insufficient blood and also oxygen supply to the cardiac muscle, cause them to be weakened, and they have no enough force to pump the blood. Then for the valvular disease, they will cause the backflow of the blood when the heart is pumping, then the circulation will be inadequate. Then for hypertension, it will cause the heart to have increased workload because the heart have to pump more forcefully to overcome the pressure. Then for other diseases like pericarditis and cardiac tamponade, the fluid accumulation around the heart will compress the heart, which will limit the ventricular filling and also the myocardial contractility. That's all for causes. Now we go for signs and symptoms. Okay, we can divide into left and right. So for left-sided failure, the patient will have pulmonary congestion and also respiratory control mechanism disturbance. So the patients will have signs and symptoms such as dyspnea, orthopnea, bilateral crackles, cough, nocturia, oliguria, fatigue, and also weakness. Then for right-sided failure, the patient will have peripheral edema and also venous congestion of organs, such as hepatomegaly. Then the GIT venous congestion, which will cause the patient to have anorexia, nausea, and bloating. Okay, we've covered the signs and symptoms, so now we go for the specific assessment. Okay, so for specific assessment, first of all, the doctor will assess the presenting symptoms such as SOB, fatigue, and abnormal lung and heart auscultation, or any other sign and symptom that the suspect is CHF. Then they will go for blood test, which is the beta-type natriuretic peptide. This is an enzyme which will be produced when the heart is stretched or overloaded to work hard to pump the blood. They can be used to detect, diagnose, or evaluate the severity of CHF. Then they will also go for the albumin, electrolytes, and creatinine to assess whether the kidney and liver is affected result from the CHF. Then maybe they will go for ECG if they suspect the CHF is resulted from myocardial infarction, arrhythmia, or any other causes that the ECG can detect. Then maybe they will go for chest X-ray to detect the cardiomegaly or pleural effusion. Then for the echocardiogram, it is a common assessment that they will do for the CHF patient. It is an ultrasound which provides the information about the cardiac structure and function, such as the chamber size, ventricular function, the pumping function by assessing the ejection fraction, then monitor the cardiac muscle, cardiac valve, pericardium, myocardium, endocardium structure, thereby to determine the underlying cause of CHF. Then the cardiac catheterization is optional if they suspect that the CHF is related to coronary artery. Then MRI and CT scan is also optional, just in case that the result from the echocardiogram is insufficient. Okay, that's all for the specific assessment. Then we will go to the treatments of CHF. So treatments, it includes the surgery and also medication. Surgery depends on the underlying problems. For example, if they find out that the problem is caused by the coronary artery block, then they will go for CABG or cardiac catheterization. Then if they find out that the CHF is caused by valvular problem, then they will go for valvular repair. So for the medications that for CHF patients, it is used to treat the underlying problems or to relieve the symptoms to prevent the worsening of the condition. So first, the diuretics, it is used to reduce the circulating volume and also pressure by increasing the urine output. Then vasodilator, it is to reduce the volume of the heart. Then angiotensin converting enzyme inhibitor, it will cause vasodilation to reduce the volume of the heart and increase the cardiac output. Then for beta blocker, it will decrease the blood pressure, decrease the heart rate, and also reduce the cardiac demand for oxygen. Then for inotrope, this is actually optional, depends on the patient's condition. It aims to increase the contractility of the heart. Okay, that's all for treatment. Then now we move to the complications. Complications involve different systems. So the patient can have acute pulmonary edema, then kidney failure due to the reduced blood flow to the kidney, heart valve problem because the heart is enlarged and stiffened and the valve cannot function properly. Then heart rhythm problem due to arrhythmia and liver damage because the fluid build up surrounding the liver cause too much pressure and leads to tissue scarring. Okay, now we move to the last subtopic, nursing care. Okay. So for CHF, the related nursing diagnosis that we can have include ineffective tissue perfusion, excessive fluid volume, decreased cardiac output, impaired gas exchange, activity intolerance, fatigue, disturbed sleep pattern, anxiety or fear. Then the general nursing consideration when caring for CHF patients include the hemodynamic status monitoring, such as the heart rate, blood pressure, the oxygen saturation, central venous pressure, respiration rate, or anything else that the doctor will order. Then we have to assess for their respiratory status, such as the rate and also the quality, to see any tachypnea or dyspnea. Then we have to assess for the altered level of consciousness due to the disturbed cerebral perfusion. Then we have to maintain the strict IO chart and to ensure that the urine output is more than or equal to 0.5 ml per kg per hour, and also to weight the patient daily to monitor for fluid retention. Then we have to assess for peripheral temperature and pulses because the CHF patient will have poor peripheral circulation. Then the peripheries will feel cold and the peripheral pulses will be weak. Then we have to assess for peripheral edema and also the functional level of mobility and ability to perform ADLs. Then for the part of mobility, we have to evaluate the need and determine the type of assistive devices that may be needed. And if the patient is immobilized, we have to assess for the sign of thrombophlebitis, such as redness, localized pain, and swelling, because they can develop thrombophlebitis due to prolonged bed rest. Then if the patient is unable to perform ADL on their own, we have to assist them. But we have to provide adequate rest in between activity to promote the venous return, the cardiac output, and also renal perfusion. Then we have to put the call bell nearby the patient just in case that any assistance is needed, they can call us. Or for the patient who are unable to press the call bell, we can place them near to the nursing counter so that we can have close monitoring and also observation. Lastly, we can have health education. So we can educate them about the importance of appropriate exercise, weight control, nutrition such as low salt, low fat, low cholesterol, or fluid restriction if ordered by doctor. So if the patient have fluid restriction, we can teach them the alternate way to keep their oral mucosa moist, such as soak the cotton ball with water, then moist their mouth and oral mucosa with the cotton. Then we can educate them about the possible side effects of medications, such as decrease in blood pressure, electrolyte, and heart rate. Because CHF patients normally take a lot of medications, which we known as polypharmacy, so that they should know about the possible side effects and know that which side effects is serious, which require them to seek for medical attention immediately. Then we have to educate them about the warning signs such as the rapid weight gain, severe SOB, severe peripheral edema, which requires them to seek for help immediately too. So I think that's all for the nursing care. So I've covered all the topics of CHF as well as the all the topics for cardiovascular system. So I think that's all for my presentation today.